Before mental health collapses, inner order collapses first. Why modern psychological frameworks fail to address the real structural crisis of human stability. In recent years, many of the world's problems have been framed through the lens of mental health. Anxiety, depression, burnout, emotional instability. These have become the dominant explanations for human suffering. But this framing misses something more fundamental. Before mental health collapses, inner order collapses first. Inner order is not a diagnosis, not a feeling, and not a personality trait. It is a structural condition of the human system. When inner order exists, a person can experience pain, uncertainty, or loss without disintegrating. When it collapses, even a comfortable environment cannot prevent internal chaos. Mental health versus inner order. Mental health frameworks focus on states and symptoms. Is the emotion normal? Is the behavior functional? Is the person distressed? Inner order focuses on system integrity. Can the internal system remain coherent over time? Can it absorb stress without breaking? Can it adapt without losing stability? A system can appear healthy while remaining structurally fragile. Inner order addresses fragility at its root, a civilization-level problem. Modern civilization increasingly compensates for inner instability through external regulation, incentives and punishment, surveillance and labeling, medication and optimization. These tools manage behavior. They do not rebuild internal structure. As inner order collapses at scale, external control must increase. Trust declines. Conflict escalates. Psychological intervention becomes permanent. This is not an individual failure. It is a mismatch between civilizational complexity and human internal capacity. Why this matters now? Human systems are becoming more complex. Human inner structures are becoming more fragile. This imbalance is unsustainable. If a civilization cannot answer this question, how can a human remain internally coherent without constant external enforcement? Then it will continue escalating control while accelerating collapse. Inner order is not a luxury. It is a prerequisite for any sustainable human future. Summary: for platforms that require it. Inner order is a structural condition of the human system that precedes mental health. Without inner order, psychological interventions manage symptoms but fail to restore stability. This concept reframes modern suffering as a civilizational, structural problem, rather than an individual pathology. Tags or keywords: inner order, mental health, human systems, civilization, AI era, structural stability.